I'm asking for you to get in touch and share what it's like for you if you are currently trying to give up smoking. What's worked? What's been really hard? Have you perhaps turned to vaping as a way to stop smoking? 0800 731 2000. I'm joined on the line now with Alizee Froguel, Cancer Research UK Prevention and Policy Manager. Great to speak to you this afternoon. Firstly, what do we know about health inequalities when it concerns smoking? Interesting statistic I shared earlier that in London, those living in poorer boroughs are more likely to smoke.
Hi, yes. So what we know is that smoking remains the biggest cause of cancer and death in the UK, and the fight against tobacco is far from over. Although smoking rates have fallen in the UK, and they haven't fallen equally across the population, and more deprived areas are being left behind. Cancer Research UK did analysis that revealed that the deprivation gap in smoking rates is not narrowing quickly enough. So there's a target of reaching smoke-free, which is defined as 5% of the adult population smoking. And that, according to our modelling, based on recent trends, would be achieved by 2039. However, by that time, levels are expected to be almost 4 times population versus the least deprived. And when we reach that target, there will still be around 460,000 people in the more deprived areas of England that would be smoking.
Why is it that people smoke when there is so much evidence of its impact on health?
Well, I think firstly, it's important to know that some people, and including people in more deprived areas, are more likely to smoke and find it harder to stop. And that is due to a mix of factors, but that could include social, housing, and income pressures that might make it harder to quit. It could include unequal access to stop smoking service. We know that ultimately smoking is addiction. People need support to quit, but that access might not be equally available across the country. It also could be down to historical marketing by the tobacco industry towards some group. But also, finally, and importantly, there's a much higher likelihood of being around, of smoking. If you're around people who smoke, you're far more likely to smoke if your parents smoke. So it can be also a bit of a vicious circle in that way.
So what's interesting around these statistics as well, just for our listeners, is the number of smokers has continually decreased for more than a decade. However, the rate of e-cigarette usage has increased. What about that? Most people who vape are actually under 25. Is that a concerning statistic?
So the evidence so far shows that legal e-cigarettes are far less harmful than smoking and can help people quit.
Okay.
However, they haven't been around long enough for us to fully understand their long-term impacts. That's why we don't consider them risk-free, which means that for people who don't smoke, and young people in particular, we don't want them taking up these products. And there's a bill that's currently going through Parliament, the Tobacco and Vapes Bill. It includes historic legislation on tobacco that would raise the age of sale tobacco, but it also includes measures to ensure that vapes are not appealing and targeted towards young people and people who don't smoke, and that's really important. But vapes are also a tool that can help people quit, and they're popular across all socioeconomic groups. So they also have the potential to help with what I was saying earlier about the unequal access, unequal smoking rates across the population.
What would you say to anyone who perhaps is just taking inspiration from a day like today, being National No Smoking Day? What should they do first? I mean, you heard my caller there, Richard, who was saying actually rather than just giving up smoking altogether, try to reduce one cigarette a day at a time to make it easier on yourself.
Well, what I would say firstly is that if you smoke, stopping completely is the best thing you can do for your health. And it's never too late to quit. It doesn't matter if you've tried before and you failed, you can achieve it, and you don't have to do it alone. Really importantly, there is support out there that can help people quit smoking, because this is an addiction and a lot of people will need support and tools. They can go to their local stop smoking services, they can go to their GP, they can go to their pharmacist, who will help identify what is the best tool for them.
Pleasure having you here on the show on Radio London. Thank you for joining me this afternoon. Alizee Froguel, Cancer Research UK and Prevention Policy Manager there. As I have said earlier on, talking about a topic like this, make sure you speak to your GP, local medical professional, and seek out the right support and help if you are making a change in your lifestyle in general or want support around giving up smoking. But if you'd like